Hi, my name is Katherine Hood, and I'm going to tell you about the LifeVest monitor for cardiac patients. Overview of this technology. The goal of every cardiologist is to save lives and prevent sudden cardiac arrest in patients. So a new device designed to monitor the patient and provide life-saving assistance in the form of a shock if a life-threatening heart rhythm occurs is proving to be a true lifesaver. Statistics show that a very low number of heart patients, of 7%, who have sudden cardiac arrest outside of a hospital survive this episode. The LifeVest can help in many types of patients, from those who have just experienced a heart attack, or patients who need heart bypass surgery, or patients who have congestive heart failure. These patients are considered high risk for sudden cardiac arrest. While the device is still fairly new in the treatment of patients, the initial studies show that a high number of patients who would otherwise die do benefit from the lightweight, simple cardiac LifeVest. Initial studies show a success of more than 90% for these patients. So what the cardiac LifeVest does is it continually monitors a patient's heart rhythm. And when the heart rhythm changes from a good heart rhythm to a lethal, life-threatening heart rhythm, then the LifeVest is able to deliver a shock to attempt to change the heart rhythm back to the correct heart rhythm, that is, a survivable heart rhythm. This can deliver multiple shocks over a short period of time, which would be provided normally by a paramedic on scene or by a bystander who's trained in the use of an AED. This here is a normal sinus rhythm, which is a good heart rhythm. When this changes from a normal sinus rhythm to a rhythm that looks like this, which is called ventricular tachycardia, then that is when the patient is in dire trouble and needs to be quickly treated. There's a ventricular tachycardia, and then the rhythm can change into ventricular fibrillation. Ventricular fibrillation is not survivable. Ventricular tachycardia requires immediate therapy. So before there was a LifeVest, what happened? Either the patient was at a mall and then suddenly went and fell to the floor and went unresponsive, and somebody had to run and grab an AED, whether at a mall or their church or wherever they were, or the person would have to call 911 if they were at home and wait for a fire department or the paramedics to get there with the ability to defibrillate the patient. The LifeVest has changed this, though, with continual cardiac monitoring through a belt that has electrodes to monitor the heart. The information is sent to a small computer that is worn on the hip of the patient. In the back of this vest are two pads that release gel to defibrillate when needed. The garment is worn as a vest, and when the patient has these lethal heart rhythms happen, it can check. It sends out an alarm and warns the patient that there is something wrong with their heart. If the patient is responsive, they definitely do not need a shock, so the patient can press the small button on the side to prevent the shock from being delivered. This prevents the patient from receiving the treatment unnecessarily. But if the patient is unresponsive, then they definitely need the therapy to save their life, and the monitor will continue to deliver the shock. After the shock is delivered, it can deliver multiple times, and the information can be sent via modem to the doctor. The gel that is released from the back prevents the patient from being burned and increases the conduction. This shock happens within seconds, about 45 seconds, instead of taking 5, 10, 15, even upwards of 20, 30, and 40 minutes before a patient receives his therapy. Defibrillators were first created in 1928. Since then, there's been AEDs that came along, and the AEDs were placed in public places, and fire departments began carrying them for rapid response. The patent for the wearable defibrillation was achieved in 1992, and the LifeVest business was acquired by Zoll Medical Corporation in 2006. The future of this product is endless, with lots of potential to where it can help save lives. This is a new technology and will continue to grow as more patients wear this device and more data is collected. This really is a huge change from what patients had to wait for treatment and possibly never live a quality life again. This treatment has been able to provide some patients with no deficit and be able to go back to a good quality life afterwards. Thank you for listening.